Hello, hello. Welcome to the Survival Analysis Understory. Today we'll be trundling through Survival Analysis Module 2. I'm Mark Williamson for DaCCoTA at UND. So let's get introduced to our topic today. So last time we soared over a general overview of survival analysis, and I did some basic examples: Excel, SAS, R, etc. Today, we'll dig our roots in deeper into the details. I'll also be showing you detailed examples in R and SAS. So that's what we have in store for us. Let's turn back to our scope that we previewed last time. We have three main groups: survival times of group, survival time compared across groups, and effect of factors on survival times. Today, we'll let the effects of factors on survival time be covered in Module 3, while today we'll look at life tables through data formatting, individual outcomes through censoring considerations, curves and the log rank test through curve considerations, and then functions through function considerations. So that's what we'll be covering. All right, let's get into our first topic here on data formatting. So for survival analysis, there are basic pieces of information you need. The most important is time and status. Status is our event, so death or not, and so when we say not event, we typically call it censoring. So here is the example from last time. We had our 12 dinosaurs. I gave them IDs, but then the important bits here are the time and status. These are just ID variables. So you need time and status for any survival analysis. Now for more complicated survival analysis, say comparing groups, you'll also need a group. And then if you're doing any sort of Cox regression, you want to look at factors, you're going to need covariates. So in this example here, I've made up a group of herbivore, carnivore, and then a fictional sort of just weighting system. So it would look something like this. So here are some considerations about formatting. You want to make sure your data is correctly formatted for survival analysis. So sometimes, now this data here is nice because it just has time, how long sent to event, but that's not the case with all data. So some data might just be dates like start date, in month, day, year, and then end date, month, day, year. So you might have to convert those into essentially time intervals rather than start and stop dates. You also might need to clarify your status. So it's typical to have your event be coded as 1. So our dinosaurs here died, so that was 1, and 0 as non-event or censoring. Though there are other setups. In fact, some old data sets actually typically had a format of 1 as no event and 2 as event because of the technology at the time being like punch cards, and 0 couldn't be coded for anything, so you had to have a 1 or a 2 rather than a 0 and a 1. So make sure your status is clarified. So you can calculate, given this information, different values for life tables if you want to construct survival functions or Kaplan-Meier curves by hand. So some important values: you're going to need to have n, your number of subjects at risk at each time frame. You're going to need to have 1 over deaths divided by, or 1 minus deaths divided by the number at risk. That's the proportion survived at that time interval. And then finally, ST, your survivor function, which is iterative. So it depends on the you take the survival function of the interval before times that 1 minus death times number at risk. And so let's see what that looks like here. So your survival function at time 0 is going to be 1 at time 0. Then at time 1, it's going to, so this next survival function, it's going to be the previous one times the 1 minus dn, which gives us this. So 1 times 0.91 gives it back. But then the next one is going to be this number times this, and so on and so forth. So you can see how this goes down until it finally gets to 0 if you don't have censoring. Okay, so that's some data formatting issues. So we've brought up censoring a lot. Now let's dig more into it. So what is it? It's when full information on exact event time is not present, also known as event time not being recorded during the time period. So there's inserts as missing information or incomplete information. And this makes sense because if you're studying a cohort, like a group of people for like 5 years, that's probably not going to be enough time to capture all events. 10 years might not be enough, and it's hard to get studies to go the lifetime of all individuals. Now, the data we're going to deal with is typically right-censored. There is left-censored data, but will only be considered right-censored. What I mean by right-censored is here we have that sort of individual outcomes of our dinosaurs. We had all 12 here. Now, there's actually no censoring in this data. We had all sorts of events between our time period, but for a more typical example here, we can see here that there is censoring, and it's right censored because it's happening on the right side of the time frame. And an important thing to note is after a first patient is censored, whether it's they get past the time frame or drop out for other reasons, survival becomes an estimate rather than a concrete matter of fact. Like our dinosaurs was not an estimate because we captured all events, so that was just the survival function, the survival totality of the system. But anything else is an estimate because we don't get total information from the censoring. And it's important to know that the informativeness of censoring needs to be considered because patients may drop out of the study or not complete due to reasons for the study. Like maybe subjects are too sick to continue to study or feel better enough, well enough again that they don't feel like they need to be in the study. So it might not be missing at random. It might have to do with the study. You might have to do something like imputation of data or sensitivity analysis to correct for sort of non-randomness. Okay. And in any case, it's important to take into account censoring. This is just an example of survival probability, considering censoring on the blue or no censoring on the red. And what you see here is if you don't consider censoring, you kind of get an overestimate of the risk. So you need to take into account censoring. Okay, so reasons for censoring, we've kind of danced around this, but 3 main reasons is loss to follow-up, withdrawal from the study, or no event by end of study period. The no event by end of study period, that's the most obvious. They survive longer than you can monitor them. So obviously, and then the second one is pretty standard, is withdrawal from study. For whatever reason, they drop out. Now, loss to follow-up is similar to withdrawal, but instead of like them actively saying, "Hey, I'm going to withdraw," it's a other sort of error that doesn't let you detect them. Maybe there's a system error, or you just aren't able to reach them for some reason. But the effect is the same. Okay, so let's look at more sort of detail of types of censoring. There is fixed type 1 censoring. This is when there's a set study time period and the same censoring time. There is random type 1 censoring, in which there's a set study time period, but different censoring time. There is, so for, this is just the most kind of standard, sort of just type 1, you have the start of a study, end of study, and then your different individuals. There's also type 2 censoring. The study ends when a pre-specified number of events occur. You can see how that is set up a little differently. We're mostly looking at essentially just fixed, or not fixed, just type 1 censoring. Now, censoring can also be generalized because you can imagine a situation like we have here, where you have this calendar time, you start the study, but not all your patients are enrolled at the same time. So you can generalize that so that all their time on study is the same. So this isn't calendar time, but time on study that you generalize it to. Okay, that is censoring. Wonderful, wonderful. Next, let's consider our functions. So in generating survival and hazard estimates, when these equations are discrete, they are iterative, so the next value depends on the previous value, and so on and so forth for each time frame, and they're used to produce non-parametric curves. So we've already seen our friend survival. We see here that that's iterative. At a certain time frame or time interval, the survival function depends on the previous time frame survival function, and this 1 minus the death over number at risk. Hazard function is similar, though it is split out by whether or not there's been death. Death is 0 or 1 or greater than 1. And then cumulative hazard deals with that risk at death at the time frame, and it's negative log transformed. Okay, now more generally, each can be derived from the other, so they're all related. So here's the hazard function, the cumulative hazard function, and the survival function here. And so if you know one, you can derive the rest. Now, in the absence of censoring, survival data could be analyzed with just an empirical cumulative distribution function. That is, to get the distribution of survival. But because most data has censoring, we just have an estimates, so we can use the Kaplan-Meier estimator. That's the most common. That's, again, produces those Kaplan-Meier curves, the non-parametric and, as I would call it, choppy sort of curves. So it's the dotted line here, that sort of stepwise sort of thing. However, you can use something like a maximum likelihood approach to estimate via these underlying distributions. These are what would be parametric, and I would call them smooth. Like you see this line here, it's a smooth continuous function. So now we have these different survival functions. What if we want to compare estimates of survival across, say, groups? So tell the difference between curves. Say we have, I just have that curve there, but say we have another one like this. Is that different from the dotted line or not? Well, what we would, and then here's the better example here. Again, with our dinosaurs, we have herbivores and carnivores. What's the difference between these curves? The standard way to test this is the log rank test. So if this is what the default, if you run this in SAS like I did, it'll give the log rank test. So there's the test statistic, degrees of freedom, and the probability, so a p-value. This one was not significant. It also gives some there are other ones like Wilcoxon or a -2 log rank. This is an alternative log rank. But there are actually others too, including the tar and wear test. In fact, I can do a different setting in SAS to have more tests, and it'll pull out other things like the pedo, the modified pedo, and the Fleming. You see here, it doesn't really matter. These were all non-significant, but there are different ways to compare curves. though we'll be sticking to the log rank test as that's the most common. Speaking of curves, let's consider them now. So the most ubiquitous survival curve is the Kaplan-Meier curve. We've seen this before. To beat a dead horse, here is yet again. We see here that it's non-parametric, so it's essentially discrete time intervals, that stepwise sort of step-like progression. Now, again, this is a non-parametric estimation of the true survival function. Because this is an estimation, it's not definitive because, as I said before, there is censoring. So we don't have all the information about those censored individuals, so this estimates it. Another way of putting it, it deals with differing survival times where censoring is present. Again, if there wasn't censor at all, we could use other more definitive methods. And because this is non-parametric, what that means is the probability of surviving in a given length of time, again, that interval I talked about, is how it's set up. And now you can have different curves, whatever, based on what it's telling you. The most common is the overall survival probability, but it could be other types of things like disease-free survival, progression-free survival, disease-specific survival. And that's just covering the epidemiological side of things. It can be other categories like economics, engineering, and the like. And these tick marks, so this little tick mark that you see here, those are the sensor data. That's how you indicate it. Now, if you want to test the difference between two curves, like we've seen in the function considerations, you use the log rank test. Now, if you have more than two curves, or you have covariates, so not necessarily groups, but maybe continuous variables like age, or more factors than just simply two, you can use Cox regression. Now, another common curve is the Nelson-Allen. Now, these are for cumulative hazards. And so while survival functions, the Kaplan-Meier goes down, cumulative hazard goes up. And now we've seen in Module 1, we saw cumulative hazard functions as being continuous. They can also be discrete, like we see here. This is across different, I think, neuroticism, so psychological, and openness, psychological personalities. And you can see the time, and depending on your low, medium, or high scores in these traits, you have differential cumulative hazard as you increase time. So again, this is a non-parametric estimation of the true cumulative hazard function. And it's used to estimate the number of expected events within a certain period of time. So more events in this period of time, higher hazard. Okay, so we had those two non-parametric. Let's turn to our parametric curves. Little psych there. I will cover this in part 3 in much more detail, but just a little teaser here. While these are non-parametric, so they're sort of discrete, these will be parametric or continuous. Suffice to say that they attempt to fit the survival curve smoothly. And here is just a couple examples. We have two different curves, I think males and females or something, shown by this one. This one here and this one here, and then using the exponential model to try to fit those. Not a great fit, but if you use a Weibull, you see that those fits to the Kaplan-Meier are much better. Again, the Kaplan-Meier is non-parametric, so it's more robust. It gives a good feel for it, so you usually fit parametric against the Kaplan-Meier. Okay, with that, we're done with such considerations. Please take assessment 1. The link is found in the description to this video. Now then, let's get our hands dirty with some survival analysis. We'll do in an R first. We'll look at the NCCTG lung cancer data set. So we'll need a variety of packages. here they are. The main one will be survival, is what we'll be using most of the functions out of. So this is the lung data set. I'll just show ahead quick here. There's the most important ones for our purposes here, of course, is we have a time variable and a status variable. You notice how this is 2 and 1. So I think 2 means death, 1 means sensor. Alrighty then, let's look at a basic plot. So we're going to use this. So we set up this serve object, time status equals 1, and then serve fit. And then we'll plot this fitted object and have the right labels. And so this is just our overall Kaplan-Meier curve. We see that survival increases as days increase. So now let's do a nicer plot by using this GG serve plot. So we'll have a sort of GG plot like feel to it. We'll fit it, have our labels, and in fact we can color it. And how that pops up here is, I'm trying to fit to a little bit nicer. Kind of like this, but given the same information. All right, so for this sort of single group, the outcome, what we can look at more like summary statistics type things. So let's look at medium survival time. So we just call fit1. It's going to give this here. It's going to give events, and then this is our median. So median survival time is 310 days. This is the confidence limits of the median. But what if we want survival time based on a specific times? Like essentially, like if we pick some sort of survival probability, we want to be able to essentially eke out how many days, and vice versa, days and survival probability. So let's look at 6 months, 1 year, and 2 years. So I've transferred those into number of days because that's the time data set or time variable. And then we pull this out here, and I just compiled it into a little table. So 6 months is a survival probability of about 70%. 1 year drops to under 50%. In 2 years, it's right around 10%. We can see that. I'm going to erase this. We look. So at 6 months, about 7, something about here. Let's see that. That's where that's at. 1 year, so 365 days. It's about 4, about something about this. You can see we can obviously do this by hand, but it's much more quicker and more accurate to let the computer do it. And this is about something about here. Let's see how that kind of lines up. Anyways, that is what's going on there. And we can do it for any sort of time period. All right, now let's turn to rat treatment. We're going to look at 2 groups. So first of all, we have rats. We have this is our one variable, it's treatment, but then our main thing is time and SAS. And again, this is 0. So that is censored, and 1 is dead for this one, and then sex, male and female. So let's start out with a basic plot. So time and status, plot it to, and this isn't death. The status is going to be tumor-free progression. So instead of death, really this is tumor. Anyways, and you see here that there's not a lot get tumors. So then digging more into this, it turns out there's a big difference between males and females. So we're going to plot it, set it up, and now instead of just by nothing, we're going to have it by sex. And so then we'll use GG serve plot, and we can see here that essentially only I think 2 rats had two male rats had tumors. Well, it was mostly confined to the females. So now let's continue with just the females. So we'll subset just by females, create a new object. This is one way of doing it, having the survive object with time and event. And then so you, instead of writing this whole equation out, you can just plug that right into our serve fit model. We'll do this by treatment now because we want to see if there's difference between treatment groups. And then do a survey plot. And here we go. So it looks like the ones with treatment 1, so I think this is the drug and this is control. The one with the drug actually had worse progression, that more of them, less of them had tumor-free progression. And we can do that log rank test. So we're going to we'll just call this. Here's the formula. And again, remember that the log rank test is essentially a chi-squared, so we have observed and expected. So here's this pulling out here, but the test statistic is the chi-squared, 8.6, and then our p-value is 0.03. So there's a significant difference. What that means is that treatment 1 had significantly more tumor events than 2. We can also do things with the hazard ratio. So we're going to do this Cox proportional regression, which will give us a hazard ratio. We'll tidy it up using Broom, etc. Here it is. And what to take from this is, again, it's significant statistic, but then this is the estimate. So this is going to be our hazards ratio. It's not called it here, it's called estimate, but that's what it is. So what it's saying is those with treatment of 1 had about 2.5 times the hazards of having a tumor compared to treatment 0. So if this was a drug, it did not help. It actually caused, or not, maybe not cause tumors, but increase the risk of tumors. All right, now that we've done that in R, let's turn to SAS, and we're going to remix the lung cancer by doing the exact same sort of thing, but in SAS with the same data set to show you that you can do the same sort of thing. So we're going to load data. I didn't show you all this, but essentially I just inputted the data, so time and status, and there's just 10 of the observations. But it's the full data set that we use in R. Okay, let's do survival plots and median survival time. So we're going to use proc life test. That's the big one here. We're going to have survival plots, the 1% at risk, and then these are, I think, confidence intervals. And this is the setup. So the time sort of, not function, but statement is going to be our time times status. Then you want to iterate which one is the sort of the control. And we see here, same sort of plot. We got an R with sensor data, with conference. Looks like this is a specific conference room called the Hall-Wellner band. And then this doesn't just give a plot, it gives a bunch of output. I'm just showing the sort of important bit. Here are some quartile estimates. So at 50%, so the median, so because the 50% quartile is the median, so median survival time is 310 days. But if we want to do it based on specific years, again, we're translating years. So this is 6 months, 1 year, 2 year. Translating that to days, we can do that, and that'll give us different things among this estimates of our specific time list. And again, we get the exact same values, 70%, 40, and a little over 10. Okay, but it's a lot easier in SAS to do hazard functions. So we're going to actually plot hazard functions by using proc life test. The only difference between the previous function was instead of plot survival, we'll do plots hazard, and here we go. This is a smoothed one, so this is parametric, or at least continuous. And we can see here that hazard increases, especially sort of levels off at the median here, but especially increases here and here. We can also do the cumulative hazard function, which we're going to need to do a little bit more here. We'll need that Nelson curve method. These things are the same thing, but then we're going to output this thing called product limit estimates in a new data set called lung PLE, so product limit. And we can print that off, but then the main thing is we're going to do a SG plot where we're going to have a series, X is time and Y is cumulative hazard. And then we get something like this, and that's pretty nice. You can see here, this is that Nelson-Allen estimate, that curve. This one looks like this is non-parametric. So it's sort of choppy, or at least, anyways, but it's not normalized to 1, so we could have normalized this, but here you are for now. Okay, now let's do a different data set with bone marrow transplant. So this is from, you can get it from SAS Help, so I create a new data set called data BMT, set it as this, so we can modify as it needed, print it a little bit. So now we have a group. There's different groups, time and status. Here, this is censored, and then one is dead. And so if we want to do a frequency table to look at group and status, here we go here. We have 3 disease groups. There's AML high risk, AML low risk. And there's different setups, but essentially there's event and censored. If we look in the all group, 36% were censored, 63 died. Whereas in the high risk, there's a higher proportion, 75% died. But the low risk, only 46% died. So those are some important numbers there. But let's get to our survival plot. We'll do life tests. This is just overall, so we're not going to set anything else. And this is the outcome. So it drops off initially here, but it sort of levels off here, and we have a lot of censored data at this point. So the total survival is around 50% in this time period. So let's do a survival function for low and high risk, and then the rank test. So we're just going to use it 2 groups, low and high risk. So one way to do that, we can just do a life test again, but then add a where statement where we essentially exclude the all group. And then if we want to strata, we'll strata by group now, which just has 2, the high risk and the low risk. And then we'll use the log rank test for the test. I think by default it'll do multiple ones. Here's our plots. We can see here that the low risk had a lot better survival than the high risk. And in fact, with the log rank test, that is significant. So those with low risk in the low risk group had significantly better survival. Another way to put it, the ones in the high risk had significantly worse survival. Okay, we can do the hazard function for this. So changing plots to hazard from the survival. We can see here, pretty kind of interesting here, that the low risker had a little slowly sloping survival where the high risk had a lot of variability. Again, this is sort of instantaneous survival at certain times. So right away there's a huge spike in risk, and another spike, and then a spike near the end. Okay, now let's do the cumulative hazard, same sort of thing here. Got to do a little more work, get this product limit estimate out into a new data set and then SGplot. We can see here that, yeah, look, unsurprising, the hazard function, cumulative hazard function, so cumulative hazard function for low risk is a lot more modest. You know, it's increasing, of course, all the time, but not nearly as much as the high risk, which shoots up and continues to shoot up. Okay, so with that, let's look at adding a third group, because normally when you have more than 2 groups, you turn to Cox regression, but you can still do that with 3 groups with just setup. You just need to add, first of all, we have no group, we're not leaving out the all group, and then also we want to make a thing called the SIDEC adjustment on the log rank, such that we have more than 2 groups. Sort of like in ANOVA, you might have, you're essentially doing multiple t-tests, but you adjust for it, like a Bonferroni adjustment to adjust for the multiple comparisons. That's sort of what's going on here. So here's the plot, the survival plot. We can see here that all is sort of in the middle, low risk is above, and high risk is below. We can do a adjustments for multiple comparisons. So what this really tells us is nice. First of all, the high and low risk, that's again significant. And then the all versus low risk, so this comparison. Now with the raw p-value, it's significant, but actually doing the adjustment, it's no longer significant. And then between the high and all risk, that was insignificant no matter what you did. So there we go. So what we can say here is that high and low risk are significantly different, but they're not different from the all group. And we can plot curves separately if we really want to by using this strata by panel. And here we go here if we really want them by themselves rather than together. All right, here's an assessment 2, mostly on R and SAS considerations. Link is in the description below. So with that, let's have some caveats and concerns. Make sure we're not getting too big for our britches, me included, me especially. So if your data, survival data, has too much or too few century, that can be problematic. So if there's no centering at all, like our dinosaur data, you could really just do something like standard regression or using I think I mentioned earlier, a cumulative empirical function or whatnot. So you might not even need survival analysis if you don't have sensory. If you have too many sensors, it really questions the validity of the study design. Just like with any sort of analysis with a lot of missing data, it might not be valid if you have too much of it. So keep that in mind. So another thing is truncation is also a thing in survival analysis. We didn't really cover it, but you can essentially, what that means is individuals within who time within a certain observational window are observed, and then no information is given if they're not in that window. So while censoring has partial information, truncation has no information for those without a full sort of event time in the window. So that's one way of dealing with censoring data. Okay. So another thing you want to keep in mind is you want to make sure your survival curves and survival function match, because it's easy, like with R or SAS, to type in a bunch of numbers and have the computer do something. But good to make sure your statistical tests and your sort of visualizations match up, so they're telling you the same story. That is, you entered the data correctly, you did the test correctly, so your results match your data exploration. Okay, so another thing you want to make sure that your assumptions are being met. And this is adapted from assumptions about survival analysis for, I think, radio tag data, but it's more broadly applicable. First of all, in some situations, random sampling, that might not be the case for like epidemiological data, so that may or may not hold. Though you still want the assumption of independent survival time, so different individuals shouldn't have linked survival times. And measuring how you measure survival doesn't impact survival. So by the fact that you're measuring how well they do shouldn't make it easier or sorry, not more or less likely to survive. And another assumption is the time to event should be known with accuracy. It shouldn't be like, well, we think they died within this year and this year. It should be like pretty exact. And then the other thing is the centering mechanism is random. We already talked about centering, where if people drop out of the study, it should be at random. It shouldn't be systematically biased because of your study design or whatnot. So we need to keep those in mind. So enough of me spouting out things. Let's take a look at some real-world examples of papers that actually use survival analysis. So our first one here by Orr et al. Looks at a chemical associated with neuroprogenitor phenotype in normal brain and shorter survival in malignant glioma. So what they did is they looked at epigenetic modification of DNA by this cysteine methylation. So it's apparently an important process. So what they found was a significant relationship between low levels of this 5-HMC and reduced survival. And what this shows, so this is, I think, all, and so these across groups, see if they have high levels, they had worse survival compared to low levels. But then over here, same sort of thing. And then these were significant. Okay. Turn on to another paper. This is time from dementia diagnosis to nursing home admission and death among persons with dementia, so multi-state survival analysis. They looked at transition time from dementia to nursing home. So instead of, and then also admission or death, and then looking at these sort of different covariates. The main thing here is they did Markov multi-state survival analysis with Flessis parametric. So this is the parametric version, which we'll look at more, but another thing they found is the probability of nursing home admission was greater for women than men due to women's lower mortality rate. So the key point I want to take home from here is you see these smooth survival functions, and that women had better survival in a nursing home than men because they had overall higher survival. And there's a lot more packaged in here that I just sort of skipped over, but there's a lot going on. And then age, dementia, etiology, and severity did not influence the probability of NH admission. So even though these factors that they think might have to do with it, did not. So not every variable you examine will be significant. Right, let's summarize and conclude. Survival analysis provides estimates of survival for a group and can also determine if two groups are significantly different. So we looked at survival across groups and multiple groups. You need to keep centering in mind, and the selection of how you use function curves and tests depend on what you're analyzing. So please tune in next time for a deeper dive into the details of survival analysis. We'll look at especially things like parametric models, Cox regression, and other specialized models in Survival Analysis Module 3 Deep Dive. Here are some references for you that I covered here. And as always, this is supported under the NIH, so please cite the BERD Core if you found this material useful for you.